welcome to another edition of Hypnosis Helps with me, Neil Myers, hypnosis practitioner, and my colleague Bill Miller, fellow hypnosis practitioner. Welcome. And on this edition of Hypnosis Helps, we're going to cover a topic which we have covered partially in other shows, if you've watched some of those other shows, but we're going to approach it slightly differently in this show. And the specific topic that we're going to talk about is self-anesthesia. Now, we've spoken about anesthesia in the past and hypnotic anesthesia. Of course, we're distinguishing this from chemical anesthesia, although we're going to be talking a little bit about that in conjunction with hypnotic anesthesia. But specifically, we're going to talk about techniques for self-hypnosis and self-anesthesia. And by that, I mean to distinguish between situations in which a hypnosis practitioner like myself induces hypnosis and produces states of anesthesia within the person who is in hypnosis, the hypnotic subject. Here we're going to speak specifically about how you can use this as a tool, self-anesthesia, how you develop it, how you learn it, what its value is, something of its history, and that's what we're going to devote this show to. And I believe that if you're watching this show, you're going to discover that self-anesthesia and also the similar process, which is not purely about anesthesia, but also about increasing levels of comfort, which we're going to talk about, particularly when you're undergoing certain procedures, medical procedures or others, is something that is of great value in developing. And that's what we're going to talk about. Right, Bill?
Yep, that's good, yep. Yeah, because there's really a couple different states or ways of approaching it. And one is where you can bring a subject into such a deep state of, and we're going to talk about this, deep state of hypnosis that they just spontaneously get general anesthesia from it. And we'll have you start with that in a minute. But then the other is where you're fully awake and you can put anesthesia in your jaw if you're doing dental procedures and things like that. And then we're going to talk too about the difference where you could just take away pain or take away all sensation, numb it completely, that kind of thing.
So we're going to start off with a little bit of history, but we're not going to spend too much time on that. We're just going to put it in context.
Right.
And I suppose the granddaddy of these procedures, or when we first came across it, is a man called James Esdale, who we've mentioned before. He was a surgeon in India in the late 1840s, 1848, an English surgeon, but practicing in India. And for those of you that are interested, there's this is a facsimile of his book called Mesmerism in India. Now, he uses the term mesmerism because at that point the term hypnosis wasn't even invented.
Right.
There was no such thing. So he termed it mesmerism.
But it is the same as hypnosis.
Yes, there are slight differences, and I want to be clear on this if you do read the book. It was only much later that we understood that it was possible to much more efficiently and rapidly induce hypnotic states through the use and power of suggestion. And by suggestion we mean words phrased, constructed in particular ways so as to stimulate areas of the brain and the mind to work in conjunction to produce particular states in the body. Now, at the time of Esdale, this really was barely known about. And so remarkably, in some ways more remarkably, Esdale was able to produce these extraordinarily deep states of anesthesia, which looked to all intents and purposes almost exactly the way general anesthesia does today, with a slight difference. But in terms of what he was able to do, and then, because he was a surgeon, perform some of the most extraordinary surgeries.
And one thing to mention is this is before there was really chemical anesthesia.
There was no chemical anesthesia at this time. The chemical anesthesia came in a little bit after, about 2 years after, 3 years after he writes. It starts to become used more fully.
Right.
But it's absolutely extraordinary. I mean, again, this is a surgeon describing surgical work. And at that period of time, they were operating on some extraordinarily awful things. I mean, huge tumours. And as we've mentioned before, why would people let tumours and other illnesses get to this state before operation? Well, there was a really simple reason. You stood about a 50-50 chance of surviving the operation.
Well, yeah, because you would be so traumatized by it because you're going to feel everything.
Right.
And they're holding you down and things like this. And
And in addition to that, there's no knowledge of bacterial infection or anything like that.
Antiseptic procedures and all this kind of thing.
Right.
And so of course they put it way off till a tumor's huge.
Right.
They can't stand it anymore. And then why would they do this? Well, there really wasn't any other choices. It was either just stay conscious or try his brand of mesmerism here.
Right, and there are three remarkable facts, and I don't want to spend too long on this, but just to set the context, three remarkable facts. Number one is the people, and he performed hundreds of operations, and he has accounts of the people, all report that they are completely free of any pain, any discomfort whatsoever during some of the most extreme procedures, including things like amputations and the removal of tumours from behind the eye. I mean, he describes them in great detail surgically.
Now, do they say that they're conscious?
No, they're not.
Okay.
This is another important distinction. Thanks for bringing that up.
Yeah.
They describe it here as a state of sleep.
Right.
And very usually they have no memory whatsoever of the procedure, none. So that's one remarkable fact.
Right.
The second remarkable fact, and to me actually more remarkable than that personally, at the time, remember, the mortality rate was about 50%.
On surgeries.
On surgeries.
Period, yeah.
His mortality rate for these extremely severe surgeries was under 5%, which again is unacceptable by modern standards, of course.
Right, so half the people just without this procedure would die.
Right.
Just from the surgery and the trauma. And with his, only 5%, did you say?
Yes, 95% of people would live.
Okay.
And again, the people died not only because of the trauma, but because of the secondary infection.
Right.
But this is the remarkable thing. This is what I find truly remarkable, that clearly the mesmeric processes, in his instance, the hypnotic processes, had a positive effect upon reducing incidence of, I'm guessing, septicemia, secondary infection, all the things that occur as a result of not knowing. So when the body is not traumatized, its capacity to protect itself, just to enable its immune system to fight infection, is much, much, much greater, as evidenced by this. And so, remarkable improvement. And the last thing, and I find this also quite remarkable, Esdale was a surgeon, and he was interested in performing surgery. Now, one of the inefficiencies of this methodology was that, depending upon the individual, it could take anywhere from 15 minutes to sometimes as much as 2 hours to bring somebody into a state where they were in deep enough trance to be fully anesthetized. And of course, because he was going to perform surgery on them, he would test the degree of anesthesia. So he wasn't going to perform surgery unless they were fully anesthetized. Now, of course, because of that wide range of time, 15 minutes to 2 hours, he was a surgeon. He didn't want to spend his time doing that. So he trained a whole team of people to use these mesmeric methods, passes, to bring people to this condition.
Right.
And that I find also remarkable, because these people, to put it mildly, were not highly educated people. Very often they were illiterate peasants, people who had very, very little education, but he trained them carefully in these methods. And so there would be teams of 10, 20 of these people bringing people into this condition of deep hypnosis, deep trance, and deep anesthesia.
Right.
And then when they were sufficiently anesthetized, he performed the operation.
Right.
And the only time in the book is that he, after he's experimented with this, that he fails, he doesn't do that, is when there's a particularly difficult subject who won't seem to respond, and then he brings them to that state.
He personally does that.
He personally does it.
Right.
A remarkable man. And there's a lot to say about Esdale. But the reason we start off here is because if anybody has any doubts at all that you can use these processes for deep anesthesia, just look at these books, and they're not the only ones.
Right. And the other thing to mention is, because I mean, some people will look at this and say it's, they'll be skeptical about it.
Of course.
Right. And there actually is, though, modern proof of this. The BBC did a special on Dr. John Butler, I think it was.
Yes.
And where So it's BBC. This is not a bootleg video. This
Right.
is really, they've got, ethics and all that.
Sure.
And they filmed surgeries being done, abdominal surgeries, with only hypnotic anesthesia. And I believe he was the hypnotist for someone else.
Right.
And then he had the surgery himself.
Right, exactly. So you see both instances there. You see what we call heterohypnosis. That's where there's a hypnotic operator, like myself or Bill, and a hypnotic subject. And you can check this out on YouTube.
Right.
John Butler, Hypnosis used for operations. It's readily available. And they show the operations from beginning to end. The longer one is where he is acting as the hypnosis practitioner, so it's
Right.
heterohypnosis. But again, the more extraordinary, in my view, and fascinating one, is where he himself is having a hernia operation, which, for those of you that don't know, involves a radial cut across the abdomen, and literally, you're pulling it out from inside,
Mm-hmm.
And he is using self-hypnosis only.
And
It's being done in a hospital in actually not far from where I used to live, in Chelsfield, near Orpington in Kent.
That's really the important point to get across here is this is not, you can learn to do these things,
Yes.
to give yourself self-anesthesia.
Yes.
And in that case, with an abdominal surgery.
Yes. Now again, let's take this. We use this because we want to illustrate how much you can do with it.
Right.
But we want to be very clear upon this, that we are not expecting people who learn these processes, unless they want to, unless they practice greatly, to say, okay, if I need a major procedure, I'm going to use hypnosis. That's not what we're talking about here.
No.
Can it be done? Yes, demonstrably. Another well-known person, Angel Escudero in
Right.
Spain, a surgeon, has performed, he retired recently, but he performed over 900 operations using only hypnotic anesthesia. He calls it something else, but his essential procedures are exactly the same.
Right.
But our point isn't that. Our point is that you and I and all of us can learn something which we can use in a variety of different ways, which we're going to describe, which will ensure that other things that we encounter on a regular basis are easier, more comfortable. Because let's face it, most of us are not, fortunately, in a position where we have to endure or suffer major surgery on a regular basis. And
Right.
fortunately, chemical anesthesia these days, whilst it does still have many downsides, is generally safer than it's ever been, and is usually the methodology of choice for anesthesia for obvious reasons.
Right.
And we're not contradicting that. We're going to describe how it can be enhanced.
Right.
But
That's a
we're
good
talking
point.
about something else.
Yeah, that's a good point. And the only reason we're bringing this all up is
Right.
just to show you the far end of what
Yes,
can be
thank
achieved
you.
with it.
Yes,
We're not
yes.
expecting anybody to do that.
Right.
But if that can be done with, like John Butler's self-hypnosis, then the simple things like dental work and things like that are
Right.
easily feasible.
Right, and so, what I want to really be clear about here is that what we're about to describe is not a trick, it's not an illusion, it's a skill that you and I and everybody can develop and practice. And like any skill, some people are able to accommodate the skill more easily,
Right.
some people more slowly, but I compare it very much to walking or driving a car. All of us have learned to walk. Some of us learned to walk when we were 10 months old. Some of us learned to walk when we were 2 years old. But once we walk, and after a little bit of practice in those early toddler years, we all walk. And nobody thinks about when we learn to walk.
Right.
Some of us are quicker, some of us are slower, but we can all achieve the skill. And this is a similar type of skill.
Right. Right.
So that's that sets the background for
Yeah.
what we do.
So and then let's just touch briefly on Mayo Brothers.
Oh, so
The
important.
famous Mayo Clinic and so forth. Because one of the things you said is like, yes, most people are not going to go and do a surgery with just
Right.
hypnotic anesthesia. But you mentioned it about reducing the amount of anesthesia used, and this is a great example of that.
So, what the Mayo brothers discovered after instruction from one of the great hypnosis practitioners of the past, who we've also mentioned before on the show, Dr. Henry Monroe, is that they could greatly reduce the amount of chemical anesthesia needed if the process of using chemical anesthesia was supplemented with the hypnotic process.
Right.
Very, very simple hypnosis, which was practiced by their two. Actually, there were two lady anesthesiologists, and they didn't describe it as hypnosis because they didn't want their reputation to be sullied by being associated with hypnosis, because unfortunately hypnosis had a bad rap, still does in some quarters. That's what this show is trying to, one of the things we're trying to change.
Right.
But what they were able to do was greatly reduce the level of the amount of chemical anesthesia they used, enormously. So
do you remember what the figures were?
My understanding is they were able to reduce it by a factor of 60 to 75%.
Right.
So let's just take the normal amount of anesthesia to an absorption at a figure of 100. They were able to reduce that back down to a figure of 30 or 25.
Right.
And what that meant, not just they saved money on anesthesia, but the safety of the operation was greatly, greatly increased, because even to this day, if one passes beyond a certain amount of absorption, a certain rate of absorption, anesthesia is dangerous. And anesthesiologists are very carefully trained to keep that absorption level at safe thresholds while still maintaining the state of no pain,
right.
Unconsciousness. They were able to reduce the amount of chemical anesthesia, so greatly increasing the safety of what they did without losing the effectiveness.
So
and
their mortality rates, again, were different, right?
Absolutely, and
right.
all their and that was one of the great promises of the early days of the Mayo Clinic, is that nobody dies here as a result of anesthesia or anesthetic procedures.
Right.
But they didn't tell people the secret for many years.
Right.
So one of the ways in which self-anesthesia is useful, and particularly this is the case if you use self-anesthesia for certain dental processes. When I have dental procedures, I personally do not use chemical anesthesia. I find hypnotic anesthesia more powerful, more effective. We don't have to do that. What you can do is use it in conjunction with chemical anesthesia. And so you might say, well, then why bother? And the answer is because, quite simply, you can use less, so it won't, be as traumatic for you. And even the thing that I think, Bill, that most people find the worst about dental anesthesia is the prick of the needle going into the palate or the gum, and you can anesthetize yourself for that.
Right.
So, it has great value.
Well, depending, that's right, because I've had enough of my own dental work. Unfortunately, grew up without the fluoride in the water. But that's exactly right. Depending on where you're injecting, the hard palate, I've had it injected there, and it's the only time I ever yelled in a dentist chair. It was that painful, because I didn't know these procedures and so forth at the time. But yeah, it can be very painful, and depending on where they're working, they may have to hit you in multiple places with that needle to get the anesthesia. And now you've got a huge part of your mouth can be numb, and that's just not pleasant afterwards, and,
right.
and so forth. And so a lot of people, I've talked to people about this, and they say, oh, I would never try that for dental work. But I said, well, you know what? You go in, you put it in, and you have them test. Just like you said that
right.
Esdale tested, you have them take one of the dental instruments and just touch that area, and they'll see that it's numb.
Right, and this is another misunderstanding about the use of anesthesia in hypnosis. People, for some reason, I still don't understand. They think it's an all or nothing thing.
Right.
Either I'm totally hypnotized and totally experiencing complete anesthesia, or nothing at all. And the fact of the matter is, just in the same way that a dentist is going to test, as a dentist would test for states of anesthesia using chemical anesthesia, they can do the same thing with hypnotic anesthesia.
Right.
Just in the same way that Esdale did, just in the same way that Angel Escudero did, and just in the same way that the surgeons who operated on our hero Ellman.
Dave Ellman. Yep.
Yeah.
Yeah. So you and I, and the thing is too, we're not just preaching these things. You and I have both used it for
yes.
dental work.
And other things.
Right. And you've used it for very deep dental work when they were drilling right
yes.
down to the nerve.
Yes.
And what did you feel?
I felt at one stage, I mean, I could, at that level of anesthesia, I felt, it's hard to know what I felt. I felt that they were working. I actually felt them moving my face around, but I didn't feel the place where they were actually drilling.
Right.
So in other words, I could feel the dentist adjusting my face, and that I could feel.
Right.
And I had that sensitivity, but I didn't have any sensation of the actual instrument drilling or what was going on. And I was told that was right on the nerve.
Yeah.
And that theoretically I should be hitting the ceiling with excruciating levels of sharp pain.
Right. And I mean, you can take away just the pain. You can or you can numb the whole thing. When I used it, I just gave the suggestion for the pain. Right. I didn't actually have it numb, completely. And what did I feel? They did some moderate drilling work, which would have been significantly painful. I did feel a vibration of the drill on the tooth, but it's more like just a little, like you would feel when you did something like this, instead of like this actual shots of pain.
And I want to also say that, I want to show the limits of it as well. I had a dentist attempted to extract a tooth from me. Now, the dentist discovered that the tooth was ankylosed. In other words, it was fused to the bone.
Right.
And your mind won't let somebody pull your jawbone through your skull.
That's what because it was fused to the jawbone, so when they're pulling on it, they're yanking your jaw out, right, or trying to.
Yes. Yeah. And it cuts it off because it says if we allow that to happen, he won't be able to eat.
Exactly.
And if he can't eat, he'll probably die. So it stops that. It just won't let it happen.
Right.
And so I want to be really insistent. One of them that you can't, and this actually I think is one of the advantages over chemical anesthesia, truly. Our friend Esdale mentions a case where he's doing an extraordinary operation. I mean, I will say that if you're going to read this, you have to have a strong stomach because it's a surgeon describing surgical procedures.
Right.
And he describes where he's removing a tumour that starts behind the eye but is so large that it goes towards the throat. And as he punctures it, blood spurts out and it causes the person to gag and choke. Quite vivid stuff. Hope you're okay there in the audience.
Really?
But here's the remarkable thing. Without losing the state of anesthesia, the person coughs and splutters to clear the blood from the throat. But yet afterwards reports that they don't remember anything, nor do they have any sensation of discomfort. And they're very animated about the degree to which they felt absolutely nothing at all. So if that was a general anaesthetic procedure, of course that wouldn't happen. The surgeon would have to be draining the blood and making sure that the airways were clear, because the body would have no self-protective mechanism at that point. It's literally impeded and unable to respond.
Right.
But using these deep states of hypnosis and the hypnoanesthesia produced, the body can continue to protect itself because the intelligence of the subconscious mind remains there.
Right.
And so again, it makes one of the things I like quite simply about using dental anesthesia, so I have to, is, if you have anesthesia, you have this sense in your mouth that everything you can't talk or everything, and you drip things out of your mouth afterwards, and you look like an imbecile. And of course, none of that occurs after.
Right.
And well, I mean, you can still look like an imbecile, but not for the reasons of anesthesia.
Right. Exactly. So the other thing to mention about it is, because like I said, I've had lots of dental work, and typically, even with chemical anesthesia, and my dentist is very good at giving it, so that I really don't feel anything when he works, and so I have total confidence in him. But yet, I still find my hands are tightly clasped.
Yes.
Because I had so much in the past where I didn't have good enough anesthesia by the dentist. Right. And I'm waiting for that shot of pain. Right. And so I actually have to tell I notice it while he's doing the work. I have to say, okay, now relax your hands and do this. And here was the essential difference, because not only did I anesthetize that area, I gave myself suggestions too for, to be relaxed and things like this. Right. And I was going through this, and he's working, and I just feeling the movement, no pain. And then all of a sudden I noticed my hands were just naturally relaxed. Right. And so it also takes away a lot of that nervousness and this and that. Right. And that was even when I was sitting there, part of my mind was going, is this really going to work? It was the first time I ever did it, right? But yet, it hits you in so many different ways and makes it just so much easier.
Right.
So there's the thing that chemical anesthesia couldn't do.
Right. So let's run through some of the things. Let's just have a laundry list here now, so that people know the sort of things that we can use self-anesthesia for. Because again, one of the problems with talking about this is people tend to think of it in extremely restricted, narrow terms. Even hypnosis practitioners. But actually, there's a whole slew of things that we can use this for. And, before we go through that laundry list, I want to say just one thing about this. The reason that this is possible is because it's something that is possible for the body and mind to do. We don't do the impossible in hypnosis. What we do is we stimulate processes that are built into the organism in ways that are not commonly stimulated. But you, everybody, I believe, has the capacity to create anesthesia in their body at will. I believe it's a gift of nature, something that's built into us as the human organism that we just don't know very much about or exploit.
Right.
So the reason that it can be done is that it's possible. We can't do the impossible in hypnosis. If you lose a finger, we're not going to make it grow with hypnosis. It's not going to happen. But you can do this. So let's saying that.
And I want to add one thing to that.
Yeah.
If you think about sometimes when you have a physical trauma, a blunt force trauma or something like that,
right.
You notice a part of the area goes numb.
Right.
Now I don't know why that actually happens, but it may be that part of that facility because if you think about it, it's trying to protect you from that extreme pain,
right.
And things like this. So maybe it's the same kind of mechanism. I don't know,
yeah.
but it definitely is there.
Yeah.
You know what I mean? So yeah, some of the we talked a lot about dental anesthesia.
Yeah.
But even things like waxing hair removal.
Well, again, let's talk about this. For those of you, some ladies out there and some gentlemen have used a process of waxing to remove unwanted hair as part of personal grooming. Some people tolerate these procedures quite easily, and for other people it can be even quite traumatic. Now, some of you may know that there's a procedure out there, and who knows when this will be shown, but called Brazilian waxing. And for those of you that don't know what Brazilian waxing is, probably some of the gentlemen out there, have a look, but I'm guessing a lot of the ladies do know. Quite simply, it's waxing in an intimate female area, right? And this area this can be quite painful. Using these procedures, if you're somebody for whom Brazilian waxing or other types of waxing is part of your ongoing personal grooming routine, learning these procedures will make it forever comfortable, relaxing, easy.
Right.
So something which previously was, at the very least, very uncomfortable or very unpleasant becomes nothing at all. Very, very easy. Everything becomes much more pleasant.
Right.
So, and right now I'm going to be working with one of the local waxing salons who wants to introduce this to their clientele because they've seen a demonstration of how effective this can be.
And again, to keep hitting that theme, is that this is something that we can teach them.
Yes.
And then they use it as needed. So you don't have to come to a hypnotist
right.
every time you want a Brazilian or anything like that.
Right.
You have the facility to do it yourself.
That's
whenever.
so important. And one of my clients said to me, when I described it to her, she said, "Oh, I suppose you'll enjoy being there."
Yeah, exactly.
And I made it very clear, just as it's the same when we teach people pain-free childbirth, that we, as the hypnosis practitioner, we're not there at the procedure. I mean, you can have us there, but there isn't really much point. What our role is to show people how to induce these states in themselves.
Right.
And again, just to be very clear on this, when we teach people some of these procedures for selective anesthesia, it's eyes open hypnosis. Right?
Right.
So when you read the descriptions in Mesmer and in other places, very often the person is, completely like this. And for the sort of surgery that was being done on them, that's probably a very good idea.
Right, exactly.
But we're talking about something where your eyes, you can, just as Bill described, you can talk, you can walk, but you can selectively anesthetize areas